Joining us now to discuss the regulation of cosmetic surgery in Nigeria is Dr. Enejo Abdu, Deputy Registrar, Medical and Dental Council of Nigeria. Thank you so much for joining us on Newsnight tonight. Maybe we should start from the issue of, regulatory, role of MedCan or MDCN. How stringent really is it, on the one hand? And your findings so far, how widespread, how badly is this desire for, body enhancement? How badly is it growing in Nigeria?
Thank you for having me. First, the Medical and Dental Council of Nigeria, the MDCN, is different from MDCan.
Right. Okay.
There is MDCan is Medical and Dental Consultants Association of Nigeria. That is an association of a group of doctors. The MDCN is the statutory body for the regulation of the professions of medicine and dentistry, and also for the practice of alternative medicine in Nigeria. Now, the council regulates the training and education of persons who seek to become doctors, the registration of those persons who are qualified to practice as medical practitioners. We have a register established, and to practice medicine, if your name is not in that register, the law says that you are not permitted to practice medicine legally. Then also to prescribe a code of conduct, the Code of Medical Ethics in Nigeria. The extant one is the 2008 edition, is still in force. All doctors are expected to abide by that code. Failing to do that, when it is reported, they will be subject of disciplinary proceedings.
Right.
Now, plastic surgery is a branch of medicine, just like several other branches of medicine. In your reports, you pointed to pediatrics and all that. They are all branches of medicine, but all of it is medicine.
Right.
In plastic surgery, there are two problems. On the one hand, you have persons who are not doctors, who dabble into it, call themselves beauticians and aesthetic and all that. What they are doing is not the practice of medicine. And yes, they may say they are just doing
cosmetic surgery.
Once you put surgery, you are out of line if you're not a doctor.
They're doing body enhancement?
Maybe they just say they are beauticians. However,
my mother is a beautician. I mean, she never did any surgery on anyone.
Good. So
she never cut anybody open.
Not just cutting open, injecting medication into people, scraping skin, and whatever you do that is going to affect the body tissue, either piercing or cutting or giving injection or even prescribing medication. It is a practice of medicine.
So now, very quickly, because we don't have that much time, for those who want to do body enhancement and they approach, maybe they've been referred, by a friend or a sister or whoever, saying, oh, this person is good, I got my BBL, see, what I'm looking like or not. What do they need to, look out for? First, what do they need to ask in terms of questions to be sure that they're in safe hands?
First, they must ensure that the person is a registered medical practitioner. And what is the evidence of that?
Right.
He has a certificate of full registration as a medical practitioner by the Medical and Dental Council. 2, that he is a plastic surgeon, qualified.
Trained as a plastic surgeon.
Yes, and he should show them his certificate of registration of additional qualification as a plastic surgeon with the Medical and Dental Council. If he doesn't have that, you have to be very careful. Because even in the hands of, yes, they are very good, mistakes could happen. But it is significantly rare as compared to those other persons, like one of the experts that was interviewed, that somebody just watches a few procedures and deems
and
himself.
thinks they can do it, yeah.
A lot of mishaps happen, and we have dealt with quite a number.
Right.
And that is with the doctors. Those who are not doctors, when it happens, they are straightforward criminals who should be subject of prosecution by the prosecutorial authorities.
Have you had any such cases that you've, resolved successfully in terms of those who are not medical doctors who are practicing? Because it looks like it's growing. The trade is growing in Nigeria from that report.
No, it is not for the MDCN. The duty of the MDCN is with the registered practitioners.
Not with the unregistered ones.
The unregistered persons are to be dealt with by the police. Anybody who commits crimes or commits offense against the law.
So whoever goes, to approaches or, uses the skills of the untrained ones, they're actually doing it, they're on their own.
Yes.
That's what you're saying. They take a very huge risk.
No, you're taking a very huge risk.
And now, from this report, they're getting more and more younger. As you heard those two ladies, young ladies, saying that they're ready to, do their BBL and what have you.
It's okay if it is done in the right hands.
Is age not a factor in terms of, how early you can...
The specialist plastic surgeon will make a determination whether or not the person qualifies for the surgery. You don't just start operating because the person says operate. That's what a doctor does. You assess the patient and decide whether or not the procedure is safe and necessary.
But from all indication, money is a huge factor here.
That is where the unethical practice
seems to be good.
The unethical practices now come in. If your motivation is just to operate because somebody says operate, of course you'll be subject of proceedings if it becomes reported to us. And we have dealt with quite a number of doctors.
Right.
Doctors now who ran afoul of our code. And what
are the punitive measures for such doctors?
They get investigated. If the investigation shows that there is evidence of wrongdoing, they will be prosecuted before the disciplinary tribunal. And if found guilty by the tribunal, their names could be erased from the register. Now, for a doctor, erasure from the register is a death sentence.
Right.
It means that you have ceased to be a doctor.
You can't practice anywhere in the world.
Or the person could be suspended.
But MDCN, do you do monitoring? How proactive are you to go out there and be sure that you don't have these people, who are carrying out unethical, practices? Is that within your purview at all?
Monitoring, yes, we do monitoring. We ought to do it more.
Right.
Considering the amount, the level of problems we have seen.
Right.
But yes, we do monitoring, but we ought to step it up better so that we will be able to
save as many people as possible. Yeah. Quackery definitely is an issue. Well, we'll have to leave it there. Dr. Enejo Abdu, thank you very much. Deputy Registrar, Medical and Dental Council of Nigeria, MDCN.
Thank you
very much.